What if your business never missed calls and answered customers 24/7 and even gave your staff their time back without actually hiring a new person? My name is Anmol and I'm the co-founder and CEO of Emitrr. In this video, I'm going to be talking about the impact of AI and how can you use AI in your healthcare practice. So think of it like an AI answering service, and that's essentially the topic that I'm going to cover in today's call. We work with 1,000+ healthcare businesses. And one question that I continuously keep getting asked is that, hey, how do we reduce our missed calls to zero? Our staff spends too much time on phone calls. Staff turnover is really high. How do we solve these problems? In a lot of cases, we've seen companies or healthcare practice owners use answering services as the solution, but they've never been happy with it because it just lacks what your business is all about. Answering services just do not follow or understand your culture, your business, as well as you do. But today with AI, that problem can be solved. So I'm going to be talking about what are the top ways in which AI can help you and how should you go about thinking to use AI as an answering service for your business. I'll cover 4 different goals that you should think about when thinking of an AI answering service, right? And when I say an AI answering service, I mean the real AI, not an answering service that has humans sitting at the back. Goal number 1. You should use AI to reduce your level 1 or L1 calls, as we call them in healthcare practices. So what are these level 1 calls? Basically, if you're getting too many calls at the practice or at your business with patients calling in and asking, hey, when's my appointment? What are your open hours? Where's the location of the practice? And things like that, which are straightforward to answer. Use an AI system to reduce these level 1 calls or completely eliminate them. We work with healthcare practices and we've seen at least an 80% reduction in level 1 calls. Let me clarify what I mean by level 1 calls. I'm not talking about appointment related calls, reschedule or billing related calls, right? I'm talking about calls where an AI can simply go in and look into your system, an EMR like Athena Health, ECW, and provide this information. So goal number 1 that you should have in mind is to reduce your level 1 calls by 80%. And that's what we are seeing wherever healthcare practices are implementing an AI solution. And they're giving all this time back to their staff. So now their staff is spending almost 20% of the time that they would actually spend on level 1 calls. So that's the goal 1 that you need to keep in mind. Goal number 2 is being available 24/7 for appointment booking with the help of an AI answering service. What do I mean by that? One question that we continuously keep getting asked is that, hey, is AI actually any good? Maybe let me change this narrative a bit and ask you a question back. If you use ChatGPT and you think ChatGPT is great, or any of these LLMs are great, then you need to understand that that's exactly the experience that your end user or the patient will also have with an AI platform that you choose. Because most of us, including Emitrr, we're using the same technology at the back which ChatGPT uses. So AI does work and it can actually schedule appointments. Now coming back to the point number 2 or the goal number 2, which is being available 24/7 to book appointments. That's essentially what you want to use the AI answering service for. How does it work? Think of an incoming phone call and you have a call tree where it says if you're a new patient, press 1. If you're an existing patient, press 2. If this is regarding an appointment, press 3. The patient presses 3 or selects 3. The call goes to either an answering service, a human-led answering service, or to a receptionist today. How this can change is this can go to an AI system, and the AI system is, or AI is good enough to take that call, collect all the information, date of birth, insurance they have, what's the reason for the visit, and put all of that information into an EMR that you use. It could be Athena Health, eClinicalWorks, Dr. Chrono, or any other. So that's your second goal that you should go after when trying to understand what should I do with my AI answering service. And that's again something that we do with a lot of EMRs, and we've seen that work. I'll be honest, it's not 100%, but it still saves you a lot of times. On average, we are seeing each practice save at least 2 hours a day by automating goal 1, which is level 1 calls, and by also automating appointment related calls. Because really, if you think about it, all appointment related calls are the same. They ask almost the same set of questions, unless of course there's an edge case. So that's the second goal you want to keep in mind. The third goal that you want to keep in mind is everybody in the tech ecosystem talks about zero inbox. What I mean by zero inbox is zero email inbox. But we say that for a business, a healthcare business, or any local service business, the goal should be zero voicemails. Because the future of voicemails is actually no voicemails. If you're still using voicemails as a method to collect all the information from patients after hours or when your call is missed, trust me, you're still in 1990s or even before, right? The reason I say that is today AI is a better option than voicemails. Let me explain that to you with another scenario. If calls are coming in after hours and they're going to voicemails, your team is coming back and listening to those voicemails. Let's be honest, in most cases, they're not even listening to those voicemails. But your team is coming back and listening to those voicemails and then deciding who to get back to and who to not get back to. That's not needed anymore. When a call comes in, and if it's being missed or if it's after hours, it can simply go to an AI. And an AI can have a meaningful conversation just the way it has with a human being. The AI can collect all the information, unless of course if it's regarding an appointment booking or anything else. And it can highlight that to your team when they're back. So that's the third goal that you need to have in mind. You need to say no to voicemails, and you need to keep in mind that you need to have zero voicemails. That's the direction all the modern healthcare practices are moving into. Just the way I keep in mind that I want to have a zero email inbox where I have zero emails as unread, you should always strive to have zero voicemails. So that's goal number 3. Goal number 4 is slightly more operational, but AI helps there as well. We continue to hear from all of our customers that one of the biggest problems is they get a lot of incoming calls, incoming voicemails, and incoming text messages. But the response rates or the time to respond is really high. When we dug deeper to find out why the response time is high, we found out it's actually nobody's fault. It's just that the practice is super busy. Let me explain that to you with a scenario so you understand it better and you're able to relate to what the solution looks like. Practices that we work with would get at least hundreds of messages every day or hundreds of voicemails. Now, these hundreds of voicemails or messages could span across patients asking about insurance, prescription refills, one of the biggest reasons why patients call, or let's say, for example, wanting to reschedule an appointment or any of these. But all of these voicemails or all of these text messages or calls were going into a common inbox, which means if you have 3 different team members responsible for each of these 3 different tasks, they're actually going through all of the conversations, voicemails, and SMSs to find out which one is relevant for them, which leads to a lot of delay in responses, right? What we did is we built a capability where AI can automatically read the message or listen to the voicemail and route or categorize what this message is all about so that it goes to the right team member. So imagine if it was a prescription refill, it will come to me if I was a pharmacist. And if it was an appointment scheduling, call, voicemail, or text, it will go to the right team member who's responsible for scheduling. This led to a drastic reduction in response times. And these are the kind of things that you want to keep in mind when you use AI, when you're looking for an AI answering service or an AI product for your healthcare practice. That's it for today. These are my learnings so far. We continue to work with practices, implement AI, discover new use cases. And as I continue to do that, I'll continue to share that through videos and continue to share learnings. So feel free to subscribe to this channel and hopefully I'll see you in the next video. Thank you.